Good. Okay. Thank you, everyone. Opening the for the purpose of having hearing and decision making for the committees of Health, Human Services, and Homelessness, joint with Committee on Higher Education and Technology, for the purposes of hearing a bill for Thursday, February 18th, 2021, 11:15 a.m. agenda. The chair of HHH would like to remind everybody instituted a 2-minute time frame for testimony. And we ask that those that are doing this professionally, we have all of your testimonies in front of us written. And I assure you that all my members and the members of the joint committee read. Okay, so we're going to move to the first and only measure, HB 1296, relating to state funds. Attorney General?
Good morning. Can you hear me?
Yes, we can.
Okay. Good morning, Chair Yamane, Chair Takayama, Vice Chairs, and members of the committees. I am Deputy Attorney General Rich Stacy with the Tobacco Enforcement Unit. The department does strongly oppose the bill while respecting the current fiscal situation. This would unravel the enforcement and compliance elements required by the Tobacco Master Settlement Agreement. Much of our funding comes from the cigarette tax stamp money, as well as monies directly out of the settlement funds. Taking away and dismantling the system currently set up would put Hawaii at risk of future receipts of MSA money. Hawaii receives a substantial amount every year because we are compliant under the MSA. The tobacco industry vigorously litigates compliance with the MSA. As an example, in the latest arbitration that was finalized, Pennsylvania lost $116 million because they did not comply. And that was from their annual expected payment. Our unit, through the special funds and tax stamp money currently in place, is basically self-sustaining and operating as it does, provides assurances that the MSA monies will continue to flow. Other comments are in my testimony. We respectfully ask that the bill be deferred, and I'm available for questions.
Okay, thank you. Moving on to Department of Health. Okay.
Good morning, Chair Yamane and members of the committee. I'm Lola Irvin, representing Director Libby Char for the Department of Health. The Department of Health respectfully opposes HB 1296, and we are reminded that the tobacco settlement special funds are from the Master Settlement Agreement with the tobacco industry, a lawsuit that Hawaii embarked on because of our value of ohana and keiki and putting them first. And that with the settlement agreement was an intent that there would be dollars for public health purpose and also to protect the youth in Hawaii and across the 51 states that participated. Hawaii from the beginning set up the Tobacco Prevention and Control Trust Fund through Act 304 in 1999. With these dollars, we have seen an 80% reduction in youth smoking rates. We have seen over 30% reduction in adult smoking rates. While we have been successful in our programs, our comprehensive tobacco prevention and control programs, we do still recognize that there are populations, Native Hawaiians, Pacific Islanders, Filipino, and people who have lower income, who do not have the opportunities for healthcare and cessation programs, that receive programs for free through the Tobacco Prevention and Control Trust Fund. The services are available across the state and through nonprofit organizations on every island. We are at a point where we had 1/3 of our students smoking regular cigarettes. Now we're at a point where 1/3 of them are using e-cigarettes. And so the gains we have made have been reversed with the e-cigarette usage. And in the middle of COVID-19, we do ask you that the Tobacco Prevention and Control Trust Fund would continue to be able to provide the services.
Okay, to remind the testifiers, you have 2 minutes, especially those from the departments. You should be able to plan accordingly. University of Hawaii.
Good morning, Chair Yamane, Chair Takayama. Michael Ng for Calvert Young. The university stands on its testimony in opposition. We do have some comments on the fiscal side of it for UH as well. Dean Hedges from the John A. Burns School of Medicine is also here for any health-related questions. Thank you.
Okay, thank you. Thank you for coming from your car. Hawaii COPD Coalition.
Good morning, Chair Yamane and Chair Takayama and members of the committees. Thank you so much for allowing me to testify. I represent the over 45,000 people in Hawaii that have COPD, and we were hoping the numbers would decline because we have done so well in helping reduce tobacco usage until the vaping epidemic. And we urge that the funds stay in place so that we can help keep our state as healthy as possible. Thank you so much.
Thank you very much. Thank you for all you do. Moving on to Hawaii Public Health Institute.
Thank you, chairs, vice chairs, Jessica Yamauchi, executive director for the Hawaii Public Health Institute, which houses the Coalition for Tobacco-Free Hawaii program, testifying in opposition to House Bill 1296. We recognize the serious budget deficits the state is facing as a result of the pandemic. However, the long-term costs and harms of repealing the trust fund and the services it provides will greatly outweigh any short-term benefits. Funding for prevention and cessation services is a critical component in reducing tobacco use, as it remains the leading preventable cause of death in our state and country. 1,400 people die from tobacco use or exposure in Hawaii every year. And according to a 2018 report by the Department of Health, tobacco prevention and control policies and programs have saved the state over $1 billion in healthcare costs over the last 20 years. We have seen a strong return on investment. For every dollar spent on tobacco prevention, Hawaii saved about $6.64 in direct healthcare costs. The trust fund provides important tobacco prevention and control programs on the 6 major islands and actively works to reduce disparities in tobacco use. In addition, we have seen how the industry finds new innovative ways to hook our keiki onto nicotine. The rise of e-cigarette use among youth has undone decades of progress and has highlighted the ongoing need for tobacco prevention and control programs. The industry doesn't stop. They spend $26.1 million on marketing in Hawaii annually, compared to $7.9 that is being spent on tobacco prevention and cessation. We recognize the difficult financial situation of the state, but repealing the trust fund will have drastic impacts on the health of our communities and healthcare costs, and therefore we strongly oppose this bill. Thank you.
Okay, thank you. Jabson, John A. Burns School.
Aloha, this is Jared Sagistine of the John A. Burns School of Medicine, and we provided written testimony in opposition to this bill. Succinctly, this Tobacco Settlement Trust Fund has been incredibly important for helping support the medical school and its efforts in support of the coalition against tobacco use. We also have to deal with the downstream consequences of those who have continued to smoke. And without the support from this trust fund, the facilities would be in potential default on the bond that supports our medical school facilities. Thank you.
Okay, thank you, Dean Hedges. Okay, American Cancer Society. Okay. American Heart Association.
I'm sorry.
Oh,
Sorry.
yeah, please.
I'm sorry about that. I had some tech difficulties. Good afternoon, chairs, vice chairs, and joint committee members. Cynthia testifying on behalf of American Cancer Society Cancer Action Network. Respectfully, we stand in strong opposition to this bill. After years of decline, we've seen sharp increases in youth tobacco use nationwide in Hawaii, largely due to skyrocketing rates of e-cigarette use, and we have seen a 5% jump in high school use rates. According to projections developed by the Campaign for Tobacco-Free Kids, if Hawaii's already underfunded program is cut by 100%, that would mean 1,900 more Hawaii kids growing up to be adults who would start smoking, and increasing future healthcare expenditures by at least $39.9 million annually. The Surgeon General has determined that individuals who smoke cigarettes today have a much higher risk for lung cancer and COPD than did people who smoked in 1964, despite smoking fewer cigarettes. If you add the deaths from all the diseases attributed to smoking, the number of annual deaths climbs to 1,400 lives lost to smoking each year in Hawaii. In fact, if nothing is done to reduce smoking rates in our state, 21,000 kids under 18 currently alive in Hawaii will ultimately die prematurely from smoking. Preserving tobacco control program funding, for which we asked your support here today, is backed by extensive science, evidence, and success stories from other states. Research shows that the more states spend on comprehensive tobacco control programs, the greater the reductions in smoking, which in the long run helps to reduce future healthcare costs and save lives. The longer Hawaii invests in such programs, the greater and quicker the impact on the health of our state. We understand that the legislature has to address the budget gap and the impact the pandemic has had in Hawaii, but our kids are worth more than zero. We ask for the bill to be deferred. Thank you for the opportunity to testify.
Okay, thank you. American Heart Association.
Good morning, Chair Yamane and Chair Takayama and members of the committee. You have my written testimony, so I trust you've read that. I won't go through it all, but I just want to highlight a couple key points. Tobacco use is, even though we see low numbers in our state, we still have very disparate numbers among certain parts of our population, which I've listed in my testimony. And the need to address those populations is still very great to bring down those disparities. And of the approximately 480,000 Americans who die from smoking every year, 35% of those are deaths from cardiovascular disease, so heart disease and stroke, which is why we are so interested in this issue and work so hard on it, and work closely with our community health allies on these issues. I want to point out that our opposition to this bill is not self-serving directly, because we do not, by policy, accept local or state government funding. However, we do work very closely, again, with community partners who rely on this funding to do the important work of trying to prevent tobacco use in our state, especially among our youth. So we stand in opposition to this bill and hope you will not move it. Mahalo.
Okay, thank you. American Lung Association of Hawaii.
Aloha, chairs. I'm Pedro Haro, Executive Director of the American Lung Association. You have my written testimony, and we stand in strong opposition for the bill. The only thing that I wanted to highlight, to not take up a lot of your time, is that lung cancer continues to be the #1 lung cancer death in Hawaii, and disproportionately affects Native Hawaiians in our state. So by dismantling the prevention efforts that we have on tobacco control, we are expecting to see those increases of lung cancer rise. We're asking that this investment in prevention be continued by deferring this bill. Thank you very much.
Thank you. Mr. Chris Wells. Okay, in support, Mr. Toyofuku.
Mr. Chairman and members, I'm Bob Toyofuku, and a consultant for Tobacco-Free Kids and Tobacco-Free Hawaii, but I'm testifying as an individual because of my involvement in the anti-tobacco effort for the past 23 years. I decided to present an overview of how the trust fund was developed, because I think that none of the current committee members were in the legislature when the trust fund was created, and I felt that knowing some background was important to give you some context as you make your decision on this important issue. More details are in my written testimony. There was a lawsuit against the tobacco companies by 46 states, and a settlement was negotiated, which resulted in the Master Settlement Agreement in 1998. Hawaii passed a bill in 1999 creating the Tobacco Settlement Special Fund, which included the Tobacco Prevention and Control Trust Fund. The initial allocation was 40% to the Rainy Day Fund, 35% to the Department of Health, and 25% to the Trust Fund. Approximately, there was $40 million anticipated to go into the Tobacco Settlement Fund each year, and not just the Trust Fund. The percentage allocations were modified in 2001 when the new medical school facility was to be built, and the trust fund allocation was reduced by 50% to 12.5%. In 2012, the trust fund allocation was again reduced to 6.5%. In 2015, the trust fund allocation went back to 12.5%, with 46.5% to the
Can
general
you wrap up
fund.
your arguments?
Thank
Thank
you, Mr. Chairman.
Okay, thank you. Okay, Julian Lipser.
Good morning, chairs, vice chairs, members. I'm Julian Lipsher. I'm a member of the Coalition for Tobacco-Free Hawaii, testifying as a private citizen. I'm testifying in opposition to 1296. The passage of this measure would be seen as no small misstep and would result in a variety of negative health, economic, legal, and policy consequences. In a long career in public health with the Hawaii State Department of Health, including over 20 years with the tobacco prevention program, I was involved in the inception and establishment of the Tobacco Prevention and Control Trust Fund. The purpose of the trust fund remains to reduce tobacco use and to change the public norms around smoking. This has been a collaborative effort among government, business, voluntary, and community partners. Viewed from a public health lens, the success of this sustained effort can be seen from the significant reduction in smoking rates among both adults and youth. The achievement of these reductions have saved countless lives and hundreds of millions of dollars in healthcare, along with the emotional cost for treating tobacco and nicotine addiction. Let's not forget that the tobacco industry remains ever present. They will and have not gone away. They have found new ways to introduce novel delivery systems for nicotine. We have seen this today in the epidemic of vaping among our youth, potentially the next generation of addicted smokers. Dissolving the trust fund could send Hawaii back to where we were 2 decades ago, fighting the same battles against the multi-billion-dollar tobacco industry, virtually defenseless and without the means and resources to address their ever-present threats. I urge you to consider the good that the trust fund has accomplished for Hawaii and to oppose HB 1296. Thank you for the opportunity to testify.
Okay, thank you. Audience and members, we have a whole list of people providing testimony. Lanai Community Health Center, Waikiki Health Center, After School All Stars, Kapilani Smoke Free Families, UH Student Health Advisory Council, Hawaii Smokers Alliance, Hawaii Primary Care, Kapilani Medical Center, Adventist Health, Hawaii Community Foundation, Bay Clinic, Kokua Kalihi Valley, Blue Zones, Tax Foundation, Hawaii, and a number of individuals providing testimony. Members, any questions? Okay, Representative Bellotti.
Thank you. If I could have Mr. Stacy.
Hello?
Thank you. Mr. Stacy, I just wanted to ask, because your testimony suggested that there could be separation of powers. And I also wanted to focus our attention, not that we're not supporting tobacco prevention, but that what we're really looking at is the financing structure. When the states went in and created these master settlement funds, there were several states that didn't follow the track that we followed. I believe Alaska, California, Georgia, Illinois, New Jersey, and Rhode Island, which allowed those funds to flow into their general funds, and then any appropriations went through the normal appropriations process. My understanding is that Alaska does fairly well with their prevention funds. Has the AGs looked at the other ways in which these states may have been more successful than states like ours, which created these special trust funds?
Thank you for the question. In the last few years since I've been in the unit, we deal with most of the 46 states that entered into the master settlement. And it's apparent that every state kind of has its own system. So they all do it different ways. I'm in touch with Alaska. I don't know the main differences between them and us. For us, it has worked in the 2003 arbitration, which sounds like it's 18 years ago, but actually just ended 7 years ago. We were not contested because our system was apparently felt to be sturdy and would stand up to litigation by the tobacco companies. So I have not specifically looked into other states that maybe have better options. For us, it has worked because we are funded. We're basically self-sustaining. The money comes in every year, and we have not lost the MSA money in arbitration. Currently, 9 states are waiting for decisions any day now. And as I may have mentioned, Pennsylvania lost $116 million, and they thought they were doing a good job. So we believe our system works as it is, but we would be happy to look into suggestions.
I would urge the department, and Chair, if I could just make a comment. I think it's really important, we should not rest on our laurels. Clearly, there is a commitment from lawmakers in the state over time to support tobacco prevention. I think now is the time for us to look at and restructure the ways in which we can, the financing agreements, because there might be better alternatives. And that's something that we should be open to exploring. Additionally, I think, there's sometimes concerns that maybe enough money isn't getting out to various nonprofits that can do the work of the prevention control programs that we want them to do. And I think this is an opportune time during this pandemic to reevaluate and look at ways in which you can better restructure these types of funds. Thank you, Mr. Stacy. Thank you, Chair.
Okay, Ward.
Thank you.
Sure. Following on the same logic of that, Department of Health, would you have some metric or some statistics as to how many smokers last year, this year, or 2-year or 3-year trends? How many those who have been vaping in a year or 2 or 3-year trend? I thought you almost said that, but I think 2 minutes may not have been enough time for you.
Thank you, Representative Ward, for those questions. When we started in 2000, the adult smoking rate was 19.7%. Hawaii's adult smoking rate right now is 12.3%. So we are actually doing better than Alaska. Alaska's smoking rate for adults is 19.1%. The youth smoking rate in 1997, when we had the YRBS, since it's every odd years, was 29.2%. Our youth smoking rates right now are 5.3%. Alaska's smoking rate for youth is 8.4%. So the youth smoking rates went down over 80%, and the adult smoking rates went down over 30%.
Vaping?
Our vaping rates, so in 2015, when we started to use the Youth Risk Behavior Survey, it was 25.1%. And now in 2019, the most recent is 30.6% for high school students.
So it's gone up.
Yes, sir, it has gone up.
Regardless of the, how would you say, the last couple of years and policy changes, what's missing in that formula?
Thank you. Thank you very much for that question. That's an excellent question. So we have been responding. I know the legislature did ask several years ago when we began collecting the data about what we are doing. And so we brought together with the Hawaii Community Foundation and with the Department of Education an immediate response to provide some educational information for the schools. And since then, we've also then updated the request for proposals and have a contractor that began the Escape the Vape campaign. And that started in December. We've also then updated the contract services for the Hawaii Tobacco Quit Line. So we also now have a youth quit line service as well called My Life, My Quit. And it uses a text message, and it's especially geared for youth and young adults to help them quit vaping. So those are some of the things we have done. The Hawaii Community Foundation also put out a prevention grantee RFP, and there are prevention grantees on every island to address youth vaping. We have also come back about 5 years now requesting also policy changes that would include parity for e-cigarettes like we have for combustible cigarettes. So we would be able to have regulation of e-cigarettes with permitting and licensing and price increases at 70%.
You've more than answered my question.
Okay, thank you.
Chair, thank you.
Okay, thank you. Anybody else have questions? Okay, so Chair has questions for Attorney General. Real briefly, because this, in the compliance issue for the tobacco enforcement, you list 7 items in which the money is supposed to be used for. Is that correct? So any use outside the spectrum of tobacco would be a violation of the tobacco settlement. Is that correct?
Well, the master settlement agreement, it's my understanding, does not by itself have a strict requirement that all of the money be used for tobacco enforcement. I believe a substantial portion of the money that comes in every year goes to the general fund. 350,000 goes to our unit from the settlement money, and the rest is used for the purposes testified to here by others. The list in my testimony is under the statute, and it is basically us trying to comply with what the MSA requires. And again,
if the state complies to the use of appropriation to the general fund to address the issues of tobacco prevention programs, enforcement, isn't then we are complying with the requirements from the tobacco settlement? It's just that we're doing it through general funds rather than through this special fund?
Theoretically, if the system is not substantially altered, disrupted, dismantled, theoretically, it could be funded in a different way, I presume. One of my big concerns would be that the disruption caused by switching out of the special funds would bring us backward and put us more at risk. Right now, we have
By law, again, that's theoretical. By law, since right now, my understanding is the legislature and then through the budget process, we dictate to general funds the use, right, and priorities. So you're saying then this would be that this is a special circumstance that you guys want to continue?
I'm not sure I understand. In my testimony, I'm sorry.
Since time is of the essence, any use of the tobacco settlement money, not specifically for tobacco cessation and enforcement, would that be a violation of the law or the settlement?
Not in my opinion.
Okay, so the monies then could be used for other public health purposes. I guess in the past, for example, like maybe BT bikes or maybe Medicaid or maybe providing prescriptive medication to people who need it. Would that be an appropriate purpose for the use of the tobacco settlement money for public health purposes?
The tobacco settlement money, I believe that would be appropriate. Again, it goes back to the risk of the less money that the enforcement unit has, the higher the risk that the money doesn't come in every year. And the money that comes in every year is much more substantial than what goes to our unit.
Okay, so if there's an intentional misuse of this money, is that considered criminal?
I'm not aware. Under the MSA, I don't believe there's a criminal penalty. I'd have to have more facts on that.
Okay, thank you. Okay, we will take a brief recess to get quorum. Chair, is that okay with you?
Members, any other questions from higher education and technology? Seeing none.
Okay, thank you. Brief recess. Okay. Okay, all good? Okay, reconvening the Joint Committee on Health, Human Services, and Homelessness and the Committee on Higher Education and Technology for the purposes of decision-making for the Thursday, February 18th, 2021, 11:15 a.m. agenda. Members, for HB 1296 relating to state funds. Members, the recommendation of the chairs are to move this measure as is. We have a deadline tonight, so we'll be moving it as is. A lot of these questions regarding the fiscal use is more appropriate dealt with in finance. Members, any discussion? Okay.
Mr. Chairman?
Yes. Representative Har?
Thank you, Mr. Chairman. Thank you for the recommendation. That said, I think it's very clear the testimony was overwhelmingly in opposition. This is a very, very bad bill. This is very bad precedent. As Mr. Toyofuku noted, the settlement fund has been in effect since 1999. And I think that this is absolutely the way in which we should not be going. It's very disappointing to see that the chairs are moving this bill. Accordingly, Mr. Chairman, I'll be voting no.
Okay, anybody else? Any comments? Okay, did want to note that besides Representative Har online, we have Representative Gates, who due to health reasons is doing virtual, and we have Representative LaFresti on. Okay, so again, the recommendation the chair is to move this as is. Vice Chair, please take the vote.
Voting on House Bill 1296, recommendation is to pass unamended. Chair votes aye. Vice Chair will vote with reservations. Rep Gates?
WR.
Rep Har? No, right?
No.
Capella?
No vote.
Rep LaPresti?
Yes.
Rep Nishimoto? Rep Ward?
No vote.
Okay, thank you.
Chair recommendation is adopted.
Thank you. Same recommendation for the Committee on Higher Technology and Higher Education and Technology. Vice Chair, would you take the vote?
Members,
Questions, any comments?
Chair, can I make a comment?
Yes, please proceed.
I really want to thank both chairs of both committees. I think one of the misunderstandings out there, or misperceptions, is that somehow we are not committed to tobacco prevention. I think this legislature and legislators have over the years demonstrated that we are. But this is a time when nothing is sacrosanct, and we need to revisit and relook at how we are financing important programs across the state. And so I think this is a very important measure, asking very important questions that will be taken up by the Finance Committee. Thank you, Mr. Chair.
Thank you. Representative Gannon.
Brief comments, Chair. My appreciation to the introducers to bring more money into the general fund and to assess almost the entirety of the state budget. However, tobacco use disproportionately affects certain communities, and it disproportionately affects mine and the youth who are vaping and endangering their own health. I'll be voting no. Thank you.
Thank you. Members, any other comments? Representative Capella.
I do appreciate and understand where this is coming from, but I do think that a politics of austerity doesn't help communities specifically like my own, people who live impoverished and who need a lot of assistance. So that is the reason for my no vote as well.
Thank you very much.
Chair, just a quick response.
Please proceed.
I don't view this measure as a measure of austerity, just as for the record. Thank you.
Thank you. Any other comments? If not, Vice Chair, would you please proceed with the vote?
Chair.
Yes, Vice Chair.
Sorry. So thank you again, Chair. And I appreciate the dialogue and the testimony that was sent in. My area is probably one of the most underserved, economically depressed areas, highest suicide rates, highest drug rates, highest unemployment. While I do understand the need to fill the budget, I do understand also prevention is all about not having to deal with the bigger mass of health conditions and suicides later. Cessation and tobacco use have climbed enormously in my area. And I can appreciate the fact about balancing a budget and fulfilling the needs of the people. But at this time, I will be voting no. Thank you.
Okay, Vice Chair, would you take the vote?
Members, voting on HB 1296, Chair's recommendation is to vote on as is. Chair vote aye. Rep. Decoit votes no. Rep. Paladi.
Aye.
Rep. Ganlin. Rep. Gates.
WR.
Representative Hashimoto.
Aye.
Representative Capella,
No.
Representative Ono, Representative Quinlan, excused, Representative Woodson,
Aye.
Representative Yamani,
Aye.
Representative Okimoto. Thank you, Chair, your recommendation is adopted.
Thank you, everybody. We'll make it downstairs in time. Thank you. Adjourn.